John, based on some of those studies, can you talk about dosage and does it depend on the person? Can we take it when we're a little bit younger to maybe hopefully avoid some of the conditions down the road in our teens, or is it more beneficial as we get a little bit older?
Yes, the answer is slightly extended because even young children as young as 1 year old, actually develop forms of this condition, and it can be used with them. Some these children maybe can't even swallow a capsule, but they can put the powder onto their cereal or whatever they're having. And for a child of that age, they would use 500 milligrams a day. For the average adult, it's 1,000 milligrams a day. Now, some people have extended that. People will always think more is better, and it isn't always. And they'll take 2,000 milligrams, and there's no harm. You cannot OD on this material because it's like a food. Okay. You literally would choke yourself to death trying to stuff it down before it would have any toxic effects or teratogenic effects. So those are the dosages. The whole range of people that could take it, we're talking prophylaxis, prevention. Prevention is better than cure. But prophylaxis is one of the hardest things to actually prove, because you can say, I've been taking this for 20 years and I've never had any problems. And the thing you can't say is, would you have had problems if you hadn't been? Very hard to prove. But I, as a person myself interested, and also now as a very aged person, I've been using the material now for 11 years. My mother used it for 15 years. She died at the age of 90. Not from using this, from old age. And I've been using it for 11 years. And as far as I know, I'm as fit as a rat, and I have no degenerative conditions, or certainly no evidence of them. So the prophylaxis, yes, athletes would be very well advised to use it, because athletes suffer from non-disease forms of inflammation which respond to this material. So the answer is yes, it has broad scope. It's particularly valuable in animals, and this is very, very interesting because dogs are the best responders of all, and the dog does not know what it's having. But dogs respond extremely well. People are second on the list of responders, and then other animals beyond that. So yes, I would say in terms of prevention, athletes definitely. People who are predisposed to a fairly sedentary lifestyle also, because weight and lack of exercise on the use it or lose it principle, they also can enhance or accelerate degenerative situations.